Hi, I'm Dr. Q. For those that don't know me, I'm a board-certified chiropractic physician. I also have a master's in functional medicine and nutrition. I am the founder of Mind Body Balance Clinic in Wheaton, Illinois. It's a functional medicine and functional nutrition practice. I also am a HeartMath certified practitioner, so for programs involving that technique, we work on optimizing performance as well as helping patients balance stress, things like anxiety and depression. Along with what I do, I also like to refer out to like-minded practitioners, and one of my favorite therapies is cranial sacral therapy. And today I have the pleasure to have my friend Nancy Regan. She's going to talk a little bit about her company, Chi Baby Inc., and we're going to dive into some talk on energy medicine as well as cranial sacral, and she can highlight a couple more of the great life-changing and transforming therapies that she offers. I personally have been working with Nancy for about 15 years now. She's a great friend, she's been a mentor, and she's been a great influence on my health journey, so I'd like to welcome you, Nancy.
Well, thanks, Mike. It's been good to see you go through your journey.
It's
15 years. Wow.
I know, time flies, right?
It does. It does.
So, again, when I started working with you, you were actually working at a chiropractic office.
I was.
Guy that I was seeing, and then it's kind of how our relationship started, and from there you bloomed into your own company. So why don't you tell us a little bit about your journey? And
when I met Mike, he was, I was just fresh out of massage therapy school, and from there, I noticed that I was very sensitive as I was working on people. I was picking up a lot of information. So about, like, people's bodies were telling me a story. So I got more interested in exploring that, and through a lot of different trainings throughout the years, I went forward and studied a lot of energy type of trainings. The one I studied the most was cranial sacral training, and in particular I have studied the visionary cranial sacral training, because that's a little more intuitive in nature and less clinical, and that's just more the type of practitioner I am. So
okay, so you're kind of gravitated towards more of that like energetic side than maybe
I did
strict massage.
Because I was very interested in what the body was telling me. So just being able to really focus in on somebody and being sensitive enough to see, like, what does this person need? What is stagnant within them, like energetically, where things aren't moving well. It was interesting to me. So through, again, a lot of training and just doing a lot of sessions, that's how I pretty much fine-tuned it. So.
Found your niche there. Cool. So I guess kind of before you even knew you wanted to get into massage therapy, what kind of was your calling? What was your why behind it? I mean, I know you gravitated towards this work, but was there something that just said, this is the direction I want to go, that, personal experience or otherwise?
Yeah, I think it was, well, in massage therapy, you only have so many massages in you. So, love massage therapy, but I really love working with people, and I wanted longevity. And
you got it right, yeah.
I got it right there. So I needed to find something that was a effective, interesting, and got results type of therapy, but something where it wasn't harming, bringing harm to myself. I mean, massage therapy is pretty rigorous type of field, and a lot of people don't last years and years in it. So
I could attest to that. I mean, I was certified in massage, and I was doing that. I was finishing up chiropractic school, so I know when you're putting in 5 or 6 hours a day, it's a lot on the shoulders, the hands, the wrists.
It is.
And,
And I already had a previous shoulder injury and surgery, so I knew I needed to find something that would not be so hard on my body, but would enable me to deepen into more healing practices.
Help people, but again, still be able to do the work.
I mean, the main reason I want to be in it is I love helping people, and it's, no 2 days are ever the same.
Yeah, no, it's very true.
I love that.
Even with what I do with, functional medicine cases, everyone's very different, everyone's very unique, their story, their background, their history, their
Right.
biochemical individuality. So you have to approach each session, each appointment as a unique individual. So very cool.
It's journey work.
Yeah, no, that's well
Yeah.
put. So aside from the cranial sacral, what other types of techniques do you offer? Do you have a favorite? Tell us a little bit about that.
Well, besides the cranial sacral, I do a little bit of massage, but it's very like flowing. It's very energy based type of massage, but very minimal.
Okay.
But probably my favorite therapy to work with is a therapy called Watsu. Although it's done in the water, and it's almost like a water type of dance.
Okay.
But I've kind of merged my energy cranial work with the water Watsu work and made it a therapy that I like to call Chi 2O, which is like Chi is life force energy. So
very cool.
Again, it's just like moving people. People love it. I love to do it. It's just a very there's not a lot of people that do the work, but it's like a dance. It's definitely the therapy I love to receive the most.
Okay. Yeah, it's definitely until, you got certified and started doing this, I had never heard of it either. So when the first time I had a session with you, it was a little different. I'll say
Very
that.
different.
But, I like that you are kind of creating your own little hybrid of these different techniques and kind of making it your own.
Well, the water is like an amazing conduit for energy work. And it also helps people who have very busy minds. Something about being in the water and flowing and just being held and feeling safe, they're able to shut that mind space down and just really, really deeply relax. And people have some pretty interesting experiences with it.
That's pretty cool. Yeah.
Thank you.
And we'll kind of segue, since I wanted to kind of spotlight a little bit more on the cranial sacral. So we'll just talk a little bit more in depth on kind of what that looks like, what a session is. So if you want to just kind of start off on, what are the basic foundations to a cranial sacral session, and kind of what you're doing with your hands. Is a patient clothed or undressed like a traditional massage, and just kind of talk us through what a session might look like for somebody that's interested.
Yeah. Well, most of my clients come to me via practitioners like Mike and integrative medicine doctors and people in the psychotherapy field. So psychologists, psychotherapists, social workers send me people who they feel are stuck and need to work with their issues outside of just their mind space. Okay. So when somebody comes to see me, first thing we're going to do is kind of just sit down, and I want to just know how I can help them. So I absolutely need some background about what their challenges are or how they're feeling. Most of the people I work with, we're talking about anxiety issues, past traumas, depression, just a lot of stress or feeling stuck. Sometimes it's manifested into physical pain, things like that. So first thing we're going to do is just kind of get a baseline of what we're working with and what their goals are, and best how I can help them. And I also explain the therapy to them too, like what's going to happen and whatnot. From there, once the person feels comfortable, the great thing about Cranial is you just hop on the table. There's no need to undress or anything like that. So we just get on the table, which I usually have a heated table with, I have an infrared table here in the Glen Ellen office, which is nice. And so we get them comfortable, get them properly bolstered. And from there, so with cranial work, your main parts of the body you're working with are the sacrum, which is at the lower part of your back, the spine, and the cranium, or the head. So what will happen is I will usually start with the sacrum area and just get underneath the person's sacrum and literally just hold there.
Okay.
And it looks like nothing is going on, but that's actually a very important part of the session, because this is where I'm rooting in with the person's energy. And you can literally, well, I can, and I think most people could too. You could feel the person's like energy. It's like a wave. It's
the flow.
Yeah, it's
Okay.
like a cranial flow, and it's cool. So you just get in there, and so this is me and the person connecting, okay? And from there, after I sit there for a while, and it can be anywhere from 5 to like 30 minutes, it depends. I'm going to listen to what the person's body tells me, okay? Or their energetic body especially. From there, I'll go up to the cranium, and it's just a series of very, very light touch, like from the front of the face, the sides, the top, down at the base of the neck, the occiput ridge. Very, very light touch, but it's totally a less is more type of therapy. It really looks like nothing is going on, but I've done this for a long time, and something is going on.
Yes, I can attest to that.
Something's going on. So there's a bit of mystery to this type of therapy because I can't tell you 100% how and why this works. I personally feel there's something greater at work here. But what's cool about it is everybody's experience with it is different. Just basically, at the very minimum, people tend to go into a very like deep kind of, I call it a theta space.
Yeah, theta waves, theta realm.
Right, so they're not asleep, but they're definitely not awake. But the best thing about it is their ego space, their mind's chatter space is definitely quieted, and there's a lot of comfort in the stillness. So at the very minimal, people go into that space. From there, people can have all kinds of different experiences. Usually people tend to have some type of releases in their body. So when things are stuck or stagnant in your body, by me just giving them a little energetic nudge, they're going to release it. So they may, have some popping, some people cry, some people start laughing, all kinds of things. A lot of people say that they feel like they're floating. A lot of people get clarity on some issues that have been very challenging for them.
Okay.
Some people have like incredible visual scenes and journeys, which kind of makes me jealous because that hasn't happened.
Like a
for
little
me.
DMT dump or something along those lines.
Yeah.
Okay.
Like, what have you experienced?
So yeah, I could definitely attest to some of the release and having almost involuntary movements, especially in the arms or the feet. I would say time seems to, in a way, stand still, or you just lose sense of time to where I feel I get on the table. It takes maybe a few minutes to kind of get into that theta zone that you described, and then it just seems like you're kind of nudging me saying, hey, the session's over, and it's like, well, where did that, 50 or so minutes go?
That's really common, yeah.
So that's one of my big experiences. I would say also, not every time, but I know in the past I would have almost some kind of a vocal where I felt like I was putting my lips together or even whistling at times, which is very bizarre because, it's not something that you normally would think you would do. So those are some of the experiences that I can attest to, I guess, like physically. But just overall complete relaxation, and I feel like that carries into the rest of my day, or at least a couple hours of when I leave here and go back to my house or go back to work. Just a very overwhelming sense of calm and peace, and I would say even in clarity as well.
The more you experience this work and you can really feel it, the more the idea is to be able to handle your energy and not take on the energy of other people.
Yeah.
Which I can't tell you how many times people feel awful or upset or even physically ill, and it's not even their stuff. It's somebody else's.
Yeah, no, and I'm glad you brought that up.
Yeah.
That's very a good point, because the body has an innate intelligence. We were created with this ability to heal and overcome, and even somebody like myself or any doctor or therapist, we're just kind of educating and assisting the body on creating an environment of healing. So usually when we're sick, something is going on internally, like you mentioned, maybe it's
Right.
stuck energy, maybe they're just nutritionally deficient, maybe they're not moving enough, sleeping well. So we act as conduits, teachers, to assist people on saying, hey, here's what your body needs,
Right.
and let's get you on the right path there. So I thought that was a great statement that you brought up there. So it's very common in today's medical world to feel disempowered, that you need a doctor to basically heal you, like they're this godlike complex, when that's completely the opposite, at least my belief. I've seen so many people, when I give them the right direction or the nudge, they run with that information and we get complete transformations. And being a heart math practitioner, that is in the realm of energy. So with heart math, for people that aren't familiar with it, we train people on how to use their emotions and control emotions, because emotions essentially they tie in with thoughts, and then this creates a change in our neurochemistry, our hormones. So this could be, cortisol and some of these other stress hormones when we're letting thoughts kind of run rampant, where we can tap into our heart energy, our heart center. So we do a combination of visualization, creating emotions from past experiences, positive emotions, to help overcome whatever the negative depleting emotions that they may be dealing with or having trouble with. And then from there, they have this tool now. So if you're in a situation on a day-to-day basis, whether it be work or school, you can learn how to shift out of this. Like, it's like a tool or a skill. You train, your muscles, muscle memory. We could do this with our emotions as well. So I think that's kind of what you were.
And the more you can learn how to read your body and listen to your body and be aware, that's going to help you a whole lot.
That intuition, kind of that gut instinct or that
and
heart
not
feeling.
be on autopilot.
Yeah, no, it's very true. I have a lot of people with the diet, especially. They go, "Oh my God, I didn't realize that this food I was putting in was causing so much of my GI problems or my headaches or brain fog." And when they start clearing things up and they actually start to kind of monitor, they're noticing these things. So I think, like you said, a lot of people are just kind of, we're on autopilot, we're running through the motions, and we just are almost numb to what our body is telling us.
Totally.
So, very cool. That was a great explanation. And I guess real quick, kind of going back, so are all cranial sacral sessions the same? Or if you go to like a practitioner, a different practitioner, can they experience a different type of session, or is it all kind of universal? How would you say?
That's a good question. All cranial sessions are not the same, okay? Because here's the deal, like, change is constant and energy is constantly changing. So the cool thing with cranial sacral sessions is that what you experience today, next time when you come back, is going to be a completely different deal. Because, like, you're constantly changing, your body's changing, your experiences have changed, all of it. So what tends to happen is people tend to deepen into the process as they get more aware and comfortable with working with their energy. So that's one really great thing about the cranial work. That's why, like, most people I work with, I've worked with them for a lot, like, years. Because they're doing the work to kind of transition through their life more smoothly. They're learning how to align with other people and places and situations energetically, and like they're trying to learn how to go downstream instead of like fighting the current all the time. And a lot of that is all about energy. As far as different types of cranial sacral, yes, there are different types of cranial sacral. Cranial sacral work has been around since like the mid 1800s.
I didn't realize that.
Yeah, it's really nothing new. A lot of people think like it's really way out there.
Very cutting edge and new age, right?
Yeah, it's really not. It has an osteopathic base, and like probably the type of cranial sacral work that people are most familiar with is with upledger, and that's a lot of chiropractors do it, dentists, DOs. It's more of a clinical approach to cranial sacral work, and they're probably going to focus more on like the 22 plates in the head and the spinal fluid and the bones, which is all good. I think a lot of people who have like maybe more physical problems, like maybe jaw issues or neck or any of that, they might be seeking out
That
up ledger
style.
type
Okay.
of practitioners. I do what's called visionary cranial sacral, which is more, it's kind of just more intuitive based, spiritual based. So that's like, you know, I'm working with a lot of clients who are coming to me via the psychotherapy community. Or just people who are just very stressed out, you know, not necessarily that they're seeing a psychotherapist. Or people who have seen a medical professional for a while and they're just not getting anywhere with it, which, you know, most likely there's something going on, like, you know, emotionally in their heart space or their gut or whatever, you know. So it's more to work with that. So, yeah, so somebody like me, there's more intuition involved. There's more like, you know, reading energy, like, this is what your body's telling me. This is, if you tell me about a situation, like, yeah, I can read the energy of it and kind of tell you, like, well, this is, I'm never going to tell anybody if they're right or wrong, but I'm going to tell them the truth as I feel it energetically.
Okay.
So it's a different approach. It's a different approach.
Yeah, so I guess just to kind of summarize, so up ledger style of training would be
Clinical,
a little bit more, well, and clinical, I don't want to take away what you do as clinical,
No,
but
mean,
I would say more structural, physical.
Definitely,
and you're
yes.
going to be more on that energetic, mental, emotional
Right,
side
right.
of support and training.
Yeah. Not that there hasn't been a ton of training for it. Like, there's
Yeah.
still, it's just a different, I'm just more of a right brain person.
Yeah, no, that's
You
a good
know?
way.
Yeah.
A little more left brain, right
Yeah.
brain
Right.
style there. So, no, I think that was a good little overview, and it is nice to know so people
Yeah, that you have options
kind of have
with
an
this work.
idea of what they can expect or which route is maybe
Absolutely.
better for them. So,
Both types, though, are very gentle. It's
Mhm.
it's very gentle work, but it's deep. It's absolutely deep work.
yes. Oh, very good. And then you know, we've been talking about kind of energy this whole time, and one of the things I just want to highlight is, you know, energy medicine, it's maybe this kind of woo-woo out there, you know, airy-fairy, flower power type connotations that people get in our kind of, you know, almost cold, sterile medical world today. But, you know, from a physiologic standpoint, most people don't realize, or maybe they forget if they did hear this, but we, like you mentioned earlier, are energetic beings. Our cells are basically like little batteries, and we have frequencies and, you know, energy fields that are coming off of that. Why electrolytes are so important. It helps keep those batteries charged. From a, you know, conventional, you know, normal evaluation standpoint, if you've ever had an EKG, that is measuring, you know, heart frequencies, and it's energetic based. Same thing with an EEG for the brain. So these aren't like new or have to be these kind of, you know, esoteric weird therapies. They're just, you know, they're just utilized differently, and they're kind of formatted and boxed in a little bit differently, I would say.
Totally. It's back to the basics.
Yeah. Yeah, no, it's true. Whether
there's something
religious
to it.
or just being a human being in a sense. And
very much so. And it is tangible. A lot of people are like, well, this doesn't seem like a tangible therapy. It is, because like with energy, if you walk into a wedding reception versus a funeral, it's going to tangibly feel different.
Yeah.
Certain people who hug you, it's a different experience than another person. Everybody has their own unique energy feel.
Signature in a sense, or fingerprint kind of.
And that's the same with practitioners too. Like, no two practitioners have the same, you're not going to have the same experience with any energy practitioner. It's all different. Yeah.
And you know, that brings up another good point. I think it comes back to intention. So whoever, whether it's a chiropractor or energy worker, what is their intention going into it? And this is also big in people that study the shamanic teachings in the shamanic world. Is you go in with good intentions. You want to make sure you're getting good shaman to help on that guidance and those teachings there. So I think that speaks to you know, all sorts of areas of life.
You bring up a good point. It's super important when you receive energy work, please go with a very strong referral. I mean, just don't go to anybody, okay? There's many different types of energy training. You know, you have to be careful. Like, you have to be careful. So, because it can... you don't always know people's intentions, and it is actually very powerful work. And so you want to go to somebody that's, I mean, almost all of my clients are referrals, so you just don't want to go on a whim. It's not like going and getting a massage, okay? Which that can be, how many of us have gotten a massage by just, someone we didn't know, we're on vacation or whatnot, and you come out of it and you're like, oh, I'm sorry, I wasted $200 on that. I feel terrible.
Yeah. Yeah.
So but especially with energy work, don't be thinking that, oh, well, they're not hardly touching me. What can happen? Definitely, stuff can happen. Sometimes people have come to me. They had a bad energy a session, and it's literally a clean out in aisle 7.
Okay, it kind of sticks with them a little bit longer than maybe just, hey, I'm sore, or that wasn't deep enough from just a basic type massage. So.
It was just the tensions weren't good, or something didn't line up, but it happens.
Yeah,
it happens.
That's really a good point to make, because again, if it's a sphere that people aren't aware of, you don't want to go to the wrong person.
Right. It's for boundaries.
Many possible reasons. Yeah. So, well, good. And then, I would just highlight, too, on the topic of energy medicine. So, chiropractic, we're, working on the spine, and that's going to be affecting, energy flow through the body there, the nervous system, the cerebral spinal fluid. We got things like acupuncture, which is tapping into these energy meridians, and again, kind of what you alluded to about emotions and experiences that get stuck and how they can create physical manifestations as well. And so acupuncture has been around for thousands of years, and I feel like that is very mainstream now, to the point that insurance companies even cover it in certain circumstances. And then you got meditation and yogas and kundalini, which are about raising energy and your chakras, and it kind of is interesting how you got acupuncture meridians as well as these chakra points, and then the spine. Again with chiropractic and osteopaths, it all kind of tells a similar story of this conduit of energy that's flowing throughout the body. So to me, that's really fascinating. I love finding connections in all the different healing arts as well as the histories behind them. And it sounds like kind of what you're doing too. It's cranial, sacral. It's the top and the bottom of that tower, if you want to call it that.
Absolutely, yeah. So, and just being aware of it, just the awareness of your energy and other people's energy and situations and whatnot. Yeah,
no, that's a good point. And I've definitely too, again, with the heart math training, since I've been certified and been working with people in that realm, just reading and studying on the Heart Math Institute, their research that they put out over the last 30 years, how our energy fields are a 360-degree sphere that is influencing those around us. There was a cool study that they did where they took 4 people, 3 of them were trained in heart math technique and 1 of them wasn't. And the people that were trained were actually able to raise the person that was untrained's coherence just by radiating their positive, emotions outwards to it. So that just kind of speaks to and objectively shows, some of this energetic, medicine in a more, mainstream way of kind of recording and researching this. So
totally, yeah.
That's, very, very important to remember that our thoughts and our words affect people at a deep level there. So
mind, body, spirit.
It's very, very true.
It really is all connected.
So, any cool projects or things on the horizon that you are working on or
coming up?
Want to discuss, or
Yeah, I'm trying to. I'm developing some small group work with about 10 people to do like energy healing circle sessions. Energy's always different and more powerful in groups, so I'm working on that.
Very cool.
Kind of gotta wait till everybody's comfortable to be together, but I think we're getting there. And a lot of times you can do that type of work outside, which is even more powerful because, nature is the ultimate energy source.
Yeah, so. Especially if you're grounding, got the shoes off and the socks off and connecting with Mother Earth.
So I'm working on an oracle card deck called Possibilities, and I don't know, it's a very fun creative process, and card work is kind of interesting too for people.
Okay, yeah, I feel like that's another area that's maybe a little kind of out there for most, so maybe that's another
but it's fun.
A talk for another day where we can kind of dive in and maybe once you develop that program
it's
or workshop
definitely
more.
in the works. Yeah,
Okay.
It's a big project, but
Very cool. That's
what we're
definitely an
doing.
area I don't have really any education on, so I would love to, hear and learn more about it. And maybe you could even do a session on me or something and
We
show
can do
people.
that.
So that would be kind of fun. So I guess anything else that you wanted to just highlight or let people know, out there, or
I just think I think it's important for people to look at alternative ways to work with feeling better. I of course I have a huge respect for Western medicine. The training is epic to be in that field, but I think a balance of those two, of Western and Eastern, or alternative and
conventional or mainstream.
yeah, because I think the strength with alternative medicine is it's a lot about maintaining and just having good habits and being aware of what's going on, and learning to do things for yourself rather than just taking medications or whatnot. Just working on your habits.
It's empowering.
Yeah, it's empowering. But again, it's a lot about awareness, which I think is super important in regards to your health.
Yeah,
So,
no, that's great, and
Yeah.
I agree. The traditional medicine, and you mentioned about shoulder injuries, and
Yeah.
obviously want a really well qualified surgeon going in when we
course,
have an operation, acute life saving care. It's phenomenal the things that we could do nowadays. Where I think we are kind of missing the boat, and there's a big shortfall with the conventional medicine system is on those daily kind of lifestyle. Diet and the
ongoing,
energy, emotional, mental, emotional side, and so I think we do need a combination of all types of
like a good
healers
balance.
and healthcare.
Yeah,
Exactly.
good balance. Yeah.
So good. And if anyone wants to get in touch with you, how do they find you? What's the best way? Are you on socials? Tell us about that.
You'll find me under Chi Baby Inc. and
Chi, like CHI?
CHI.
Okay.
Baby Inc. And you can find me. My website is www.chibabyinc.com.
Okay. And are you taking new clients right now? Or?
I am taking new clients right now.
Okay.
With this type of work, I'm not like a. This is something that amazes me with my doctor clients. Like, they see so many people in a day, and I do not. I see about a limit of 4 or 5. So,
Okay.
But I am taking new clients. Yes.
Okay. Very good. Well, I'll put your information in the show notes, so people can look up your link or your website.
Thank you.
Are you active on any social medias?
Yeah,
or?
I'm on Facebook. I'm on Instagram. Yep. A little bit on Twitter. Not
Okay.
as much.
And you are you're doing sessions just at the one at the Glen Ellen?
Yeah, I'm working in Glen Ellen. I'm in Chicago out of Humboldt Park on Saturdays, and I also do remote sessions.
Oh, very cool.
So yeah.
That's interesting with the a Zoom technology.
Yep.
Awesome.
Thank you.
Well, again, thanks, Nancy. I really appreciate
Thank
you
you,
taking
Mike.
the time to talk about your journey, what you do, and I wanted to create this little showcase not only to highlight somebody that's helped me on my health journey, but I want my patients to have good quality healers that they can turn to and add into part of their journey as well. So I encourage people to search out Nancy and give her a call or check out her website if they're interested. If you're interested in working with someone like myself that does functional medicine, functional nutrition, I'll have my website in the show notes as well, and you can always call for a free 15-minute discovery call to see if we'd be a good fit. So thank you for your time, and again, thank you, Nancy.
Thanks, Mike.
We'll have to do it again sometime, okay?
I will. Sounds good.
Thanks.